Primary hyperaldosteronism, part 4. I have said the words primary hyperaldosteronism so many times in the recording of these videos, it's kind of like a tongue twister. Okay, but part 4, we're talking about the management and treatment of this condition. So we've already talked about what this condition is. Sometimes it's called Conn syndrome. We talked about the adrenal glands. We've talked about aldosterone. We've talked about the symptoms. We've talked about how it's tested for and diagnosed. So now we want to know what can be done about it. And that's kind of the stage that I'm in right now, which is very exciting. So again, I just want to say I'm not a medical professional. I don't know all the details of this. And even there is a wide range of how this can present in people, how it's managed for people. So if you have this condition or someone you know has it, and I didn't bring up every aspect, well, my mom has that and she had this. Okay, yeah, I'm sure she does. I don't know all the details. I'm just speaking from my experience and some of the things I've learned about so far. Okay, so we talked about in the last video how one of the parts of diagnosing this condition is through a procedure called adrenal vein sampling. So adrenal vein sampling is done to confirm for sure that one or both of your adrenal glands are producing too much aldosterone. They're checking those levels, they're seeing which side that the overproduction of aldosterone is coming from. So if it's coming from one side, and especially if they've been able to visualize that benign tumor with a CT scan, then that is confirmation that it is unilateral, one-sided hyperaldosteronism. And there is good news with that, because the treatment for one-sided hyperaldosteronism is to remove that adrenal gland. And that might sound a little bit like, whoa, like remove it. Well, yeah, because this condition, if it's left untreated, if it's left unmanaged, then it can cause a whole lot of problems. If you have chronic high blood pressure and chronic low potassium for years and years and years, that's not going to do a lot of good things for your body. It puts you at risk for a lot of things with your heart, with strokes. Not very good. So yeah, if you have it on one side, then you can have that adrenal gland removed. That's called an adrenalectomy. And then basically after that, what should happen is your adrenal gland that is remaining, that's the healthy adrenal gland, will just kind of kick in, take over the proper production of those hormones, and then your blood pressure should go back to normal, and your potassium levels should go back to normal, and you are basically considered cured then. And then you pretty much no longer have the condition. So that's the good news of having it be on one side. And surgery might not sound like good news, but if you've been living with this like I have, it sounds like very good news. But if you have the condition on both sides, if it's affecting both of your adrenal glands, it is not ideal for you to have both adrenal glands removed, because then you don't have either. You can live well. This is from what I've read, research that I've read. You can live well with half of one adrenal gland, which is so fascinating. And it's like, wow, it's almost like the Lord knew he needed to make some extra. I don't know. Anyway, but if you have none, if you have both of your adrenal glands removed, then you're not having anything that's producing that hormone, and you'll basically have to be on a hormone replacement therapy for the rest of your life, which would stink. And I'm sure there's maybe people watching this that have had that, or they are going through that, and I'm sure that that's probably not very ideal, is it? Maybe you could share them in the comments. So if you have it on both sides, you're often just managing the condition with medication. I am being attacked by Asian beetles. And again, this isn't the case for me, so I don't know a whole lot of the details of this. and I'm sure you could read more about it. I know there's one medication that starts with an S and one that starts with an E that I read a lot about. And again, if that's you, maybe you could share your experience in the comments with that. I have not been on any medication specifically for this condition. I've been on blood pressure medication and on potassium, but that's kind of just dealing with the residual effects, not ones like those that are addressing the hormonal part of it. So basically, if you have unilateral, one-sided hyperaldosteronism, you can potentially be cured of that by having an adrenalectomy, having that adrenal gland removed along with the tumor that's on there. And then the adrenal gland that's left, the healthy one, takes over and manages your hormone production from there. If you have it on both sides, then you'll just have to, I can't talk, oh my goodness. You'll just have to continue to manage it with medication, which kind of stinks. But hopefully for a lot of people that is helpful and is managing it in a way that's good. The stage that I am at right now is that I've had all my testing done. I had my adrenal vein sampling done a couple months ago, and now I am just days away. I won't say how many days, but I'm days away from having my adrenalectomy. I'm going to be having my left adrenal gland removed, which is very weird to say. Before all of this, I never really gave a second thought to my adrenal glands, and now all of a sudden this year, it's like one of the things that's almost constantly at the forefront of my mind, and now I'm going to be saying goodbye to one of them, which is kind of crazy. But yeah, the hope is that once I have my adrenalectomy, that it's kind of emotional to say that that the muscle weakness will go away, that the numbness and tingling will go away, that my blood pressure will go back to normal, and my potassium will go back to normal. Yeah, so if you're interested in following along with that too, I'm planning to share about my surgery that's coming up very soon. Yeah, and if you are also a Christian and you feel like you'd like to be praying for me with that, I would appreciate that too. Yeah, so that's what I have to say so far about primary hyperaldosteronism. I know I'm kind of rambling a little bit. I hope this kind of just feels like a conversation between friends. I'm just sharing what I know with you as a friend. I'm not doing this in a fancy way. Just sharing what's on my heart, what I've learned, my experience. And yeah, if you have questions, definitely leave those in the comments. I'm open to sharing more about my experience. I want to share maybe just also one video about my whole story of this. So yeah. All right, well, thanks for watching. And I said if you have questions,